Hello, hello, hello. Good evening, and welcome to the Senior Pet Chat with Dr. Croom. I'm glad you're here. We've got a few things going on out here in the senior pet world. But for those of you who have not joined me ever before, we come here every Monday night to discuss all things senior pets. Any questions you may have about your senior pet, go ahead and feel free to put that right in the chat. We are on several platforms right now. So whether you've joined us on Facebook, LinkedIn, YouTube, no matter where, put your information into the chat and we will get to that answer. Okay. So welcome, welcome. Tonight, our topic has to do with something that's kind of going around the country right now. And that is a series of respiratory issues in the canine specifically. So people have been hearing about the canine influenza virus. That is definitely spreading around the country like wildfire. Okay. Canine influenza, we've also got the common Bordetella bronchoseptica, which is also known to most as kennel cough. Okay. But here we are talking about senior pets, and we're going to go over just a couple of misconceptions that people tend to have about these vaccinations for their senior pets. So, again, senior pet chat tonight, and several respiratory diseases, viral diseases that are spreading around the country. Here in Michigan, we've seen a little bit here in West Michigan, but more so outside of the state of Michigan. So no matter what state you're coming from, you've got to be super careful and observant of your senior pet. Not just your senior pet, of course, all your pets. But since this is the senior pet chat, of course, that's what we're going to focus on tonight. So yeah, why don't we go ahead and talk about this canine influenza first? Because I keep seeing notifications about it day after day, and I know you've been seeing them too. Usually coming down from our state and federal agencies that are really watching these and watching the numbers and really getting on top of those statistics. The epidemiological aspect of veterinary medicine is crucial because you can't just really stay in your own bubble. You can say, okay, well, I'm just in my house with my pet only. But once you go outside, once you break that seal of your own, yard and, go to the dog park, right? Go to have your animal boarded. They're going to be mixed. So you've got to be careful with your own pet. Make sure they're vaccinated so that they don't spread something to the next. Hello, Maurice Mitchell. How you doing tonight? Great to see you. Yes. And then Robert Crazy Ear Holmes. Great to see you as well. If you have any questions, again, go ahead and feel free to put them in the chat. But right now we're talking about how canine influenza is spreading out throughout the country, and there is a lack of canine influenza vaccination. Yeah, they've been running out. Canine flu is actually not something that I typically carry all the time. As a holistic vet, most of my clients really typically don't ask for that. If they do, it might be here or there, very sporadic, but that's not something that I typically carry. But one thing that I do typically carry that also can affect that respiratory system is the Bordetella. Now, again, here's the misconception. A lot of people think Bordetella, they hear Borda, am I boarding? But it's not. That is not. Look, get that out of your vernacular right now. Bordetella does not mean only when boarding, okay? Bordetella is not only caused by one bacteria. So Bordetella bronchoseptica or kennel cough is actually a range of respiratory diseases that can affect your pet. And we just know about, Bordetella, but there's other bacteria in there as well. So keep in mind, Bordetella is not just for boarding your dogs. It's for if your dog has any nose-to-nose contact with any other dog. It could be a dog in your extended family. Your dog needs to have a Bordetella, okay? Now, we're talking about senior pets. This is Senior Pet Chat, okay? So let's dig in a little bit more as far as the senior pets. I have a lot of clients that come to me as a holistic veterinarian and say, my pet is getting older. We want to back off of these vaccinations. We do not feel like we need to give Fluffy these toxins, every year. She's had them, for 12 years, and now we want to taper off. Usually, my thought process is, after looking at that animal's history and their location and everything, I'm totally cool with backing off. I think that more and more research is coming out that shows that the amount of antigen left in that pet's body after all those years of getting vaccinations, it does add up. It definitely does. And so I agree. We can back off of some of those vaccinations, again, based on your situation. Now, if you've got a, older dog and they're still out there, you're going camping and, get out there with other dogs and doing all these other things, it might be a little different situation, and my recommendation may be different. Okay. So keep that in mind. Also, let's see. So with the Bordetella, again, kennel cough, not just for boarding, but if your dog does happen to come across this, you will know it when you hear it. Okay. It's a really, it's a honking sound, or a coughing and a honking sound that your dog might be doing. Okay. So if you hear any, strange honking, snorting, kind of snuffling sounds from your dog right now, be aware, be on top of that. Nasal discharge, we can have, runny nose in general, sneezing. All these things can be caused by not only Bordetella, but canine influenza, as well as all those other bacteria that can cause respiratory issues. Okay. So, so on the vaccination question that always comes up, it does have to do with your individual family and what's going on there. We can talk about it. That's one of the reasons that we love doing our virtual visits, right? We are a telehealth company. That's right. You're seeing it all over the place. Oh, veterinarians are starting to do telehealth. Dr. Croom Mobile Veterinary Service has been doing telehealth even prior to COVID. So we're experts, okay? We know how to get on. We know how to get you in quickly. And then if you need a home visit, here we come within the next couple of days. You don't have to wait 3 weeks to get in. So, drcroom.com is the place. And if you need us, you can definitely go there. We'll be there to help you. I'm not seeing any, let me see if there's any comments here. Hi there, Edward Saucier. Did I say that right? Saucier. And then Sydney Mitchell, great to see you. Again, Robert, also good to see you guys tonight. It's the guys. All right, it's all guys tonight that I'm seeing. All right, ladies, where you at? Where you at? Senior pet owner and ladies. All right, so no questions. That's cool. I'm about to get out of here. Make sure you tell your friends about Senior Pet Chat. And if you have any questions after and you're watching the replay, definitely feel free to hop on in and put the questions in the chat. All right. We'll see you next week on Senior Pet Chat.